Hi, Dr. Tammy Penhollow with Precision Regenerative Medicine in Scottsdale. What is a daddy do-over? I mean, we've all heard about the mommy makeover, but is a daddy do-over even anything? It was a coined term about 2014, 2015 timeframe, and we noticed that moms are often undergoing liposuction and breast augmentation, abdominoplasty or tummy tucks, as well as some facial rejuvenation as they reach that time where they start to see some changes after having their kids, and maybe the kids are getting a little bit older and they want to do a little something for themselves. The same thing can be said for men. Often in the middle 40s or early 50s, men start to notice that there's a drain on their complexion. Their skin isn't as bright as it used to be. They may start getting some fine lines and wrinkles, not only around the eyes, but in the smile lines and in the forehead, some stress and worry from raising those teenagers. And they also note that they've lost some of their athletic performance. Maybe that is that they've had an injury, there's been some time where they've not been able to work out, and they've lost some muscle mass and added some fat. There is such a thing as a daddy do-over, although you don't have to be a dad to undergo it. At Precision Regenerative Medicine, we have a couple of different options. The first is the Emsculpt machine. It's for body contouring. It can start with the core. Everybody knows that a core stabilization is the start of everything. And if you've got those tight abs and that strong core, that helps take pressure off the low back, and that can help return you back to function. We can also do a non-surgical butt lift with applicator pads placed on the glutes. I see a lot of men coming in for work on their biceps, triceps, quads, and calves. And with the Emsculpt machine, during a session, whether that be 30 minutes on the abs or on the glutes, or 20 minutes on the arms or the legs, you achieve 20,000 supramaximal contractions. What that means is, normally in the gym, you can only typically achieve about 30% of your maximum. For the session, you're actually achieving 100% of your maximum contraction. So we achieve, in a very high yield format, increased muscle mass and increased fat loss. Average of 16% increased muscle mass, fat loss in the 19 to 26%. And we achieve this in 4 sessions. We can either do this twice a week for 2 weeks, or we can spread it out once a week for 4 weeks. Either way, we'd sit down and have a conversation and determine which format is right for you. That's one part of it. The other part of it is, and we can do this at the same time in the same session, we can draw your blood, spin that down in the centrifuge, and take that beautiful platelet-rich plasma with all the growth factors and anti-inflammatory proteins and do a PRP microneedling. It induces collagen, reduces fine lines, reduces wrinkles, changes acne scars, changes little pigmentation marks, and if it's the right kind of hair loss, we can use it for hair restoration as well. So give us a call at Precision Regenerative Medicine. See if a daddy do-over is right for you. Thanks.